Hey everyone, it's Megan, and this is my husband Jeremiah.
Hello.
He's going to help me out today to do a GI focused assessment. Hey, how are you today?
I'm good.
I'm Megan. I'm going to be your nurse today. I understand that the other nurse has already taken your vital signs and stuff. Is that correct?
Yes.
Okay. What brings you in today?
Don't feel good.
Okay. Can you explain what's been going on with you? Like what's bothering you?
My stomach.
Okay. Are you having pain, diarrhea, constipation?
A little bit of everything, off and on.
Okay. Have you had any issues with this in the past?
Occasionally.
Okay. Good. So, one of the things that we have to explain is irritable bowel disease or irritable bowel syndrome. You hear it both ways. And one of the things that you see with that in an expected history would be things like constipation, diarrhea, abdominal pain. Are you having any pain?
Yes.
Okay. And even belching. However, in someone with diverticulitis, it would just be more or less an acute onset of pain, generally in the lower abdomen here. The patient's general appearance is he's clean, not dirty, has had a shower at least in the last 24 hours. Generally, he's pink all over. Doesn't look like he's feeling bad or anything, even though he tells me he's in a little bit of pain, but that's to be expected if you're having stomach issues. Do you care if I take a listen to like your lungs and a few things?
That's fine.
Okay. Something to mention on the general appearance portion, if they have IBD or diverticulitis, generally they will have a pale color over them because they are in pain or they haven't eaten because of their stomach concerns. I've seen that pretty commonly here lately. So, and also you can see weight loss in some of these patients. Okay. If you don't care, I'm going to start with the backside first. Okay. If you'll stand facing the window. Thank you. So overall, the posterior chest is even. He's pretty broad shoulder, so I'll do the best that I can showing you guys. He's even. There's no like dimpling, if you will. Pretty smooth. All right. If I'm gonna go down your spine, you tell me if anything hurts. Okay.
Okay.
Any pain or tenderness?
No.
Okay. How about on this side?
No.
What about on this side?
No.
Okay. So now I'm going to listen to each of his lung sounds with the stethoscope here. Okay. Each time you feel my stethoscope move, just take a deep breath, but not too deep. Okay.
Okay.
Ready?
Yes.
Good. Good. Okay. One more. Okay. Alright, I'm going to do one quick test. Just do one quick deep breath in for me. Okay, good. Your lungs expand really well. Okay, now if you'll turn around and face this wall, I'm going to do the same thing on the front chest. You okay?
Yes.
Alright, ready?
Yes.
Good. Good. One more. You're almost done. Alright, one more. Okay. Thank you. Now I'm going to try to listen to your heart sounds, okay?
Okay.
You don't have to breathe in or anything. Good. Okay. So there's no abnormal sounds, just S1, S2, which is normal. That's good. Something if you've ever heard the doctors talk about is the point of maximum impulse. It's where you can hear and feel the heartbeat really well. And it's generally roughly in this area. So you'll hear some doctors or nurses talk about like your mid-clavicular line and then counting down so many ribs. And it's usually right in this area. Sometimes it can hurt when you press on it. Excuse me. So then the next thing that you would do is just inspect the general abdomen area. He's a big boy like me. He's pretty round. But other than that, it is symmetrical. I'm just picking on you because I love you.
I'm portly.
It's symmetrical, you know, nothing out of the ordinary. Can I see your nails real quick? I just gotta make sure you got circulations in your fingernails. Your skin color is really good. Alright. Yep, they refill pretty quick, so like within 2 seconds, which normal is within 3 seconds. Are you ready for the next part of the?
Yes.
And I'm gonna listen to your bowel sounds and then also kind of push on them a little bit, so that might hurt just a little bit. Okay.
Okay.
All right. Go ahead. While you're doing that, I'm going to adjust the camera here. Oh. There we go. Alright, one thing I did forget is I need to do your pulses.
Okay.
So if you don't care if I see your wrist. So this one is your radial pulse.
Okay.
Which is really strong. Your heartbeat's normal. And then you would do the brachial pulse, which is roughly here. I'm sorry it tickles.
That's okay.
So on this part of the exam, if you will,
yes,
I'm going to take my stethoscope and listen to each of the 4 quadrants of the bowel. Now, I'm going to do the best I can. I know the video is probably not the greatest, but it's what I have to work with. And you go in the direction of the way that the colon is in the body. You can just lay there. Good. There's bowel sounds in all 4 quadrants. Depending on when the patient last ate will determine how active their bowels are. But as long as you hear something in each of the 4 quadrants, then you're good to go. Okay. Now I'm going to just like kind of tap on each thing. If there's any tenderness, please tell me, okay?
Okay. I'm good.
Which generally there shouldn't be any. Okay. And then now we're going to palpate in the same areas. The first go around you use just like a light touch, and then the second time you do just slightly deeper, but not too deep. You don't want to hurt your patient. But again, if there's any pain or tenderness, please tell me.
Okay.
You good?
Yes.
Alright, so that's the light. You still good?
Oh, yeah.
Okay. If your patient were to have either the irritable bowel syndrome or diverticulitis, any of that technique right there probably would have shot them up because they would be in so much pain. They would, like, their face would grimace. They'd probably try to push you away just a little bit to tell you, can't do that, it hurts. Anything you need to do to just listen to your patient. And that will conclude our GI focus assessment. I hope you guys have a great day. Bye.